I always wanted to teach. I went into nursing not sure whether I wanted to be a teacher or a nurse, to be quite honest, and I decided to be a nurse. But I always had an interest in teaching as well, and I went into my advanced practice program with the thought that I wanted to do some teaching in addition to practice. Since I've been primarily working as an advanced practice nurse in urgent care and ER settings, and then I've been teaching part-time as an adjunct faculty for about 5 years in California, and then now for about 5 years here.
I never thought myself of being a teacher or an instructor, but as I evolved, I realized not only could I was good at it. So there were several mentors in my young career that really helped me to move forward, saying, when I was an LPN, they said, well, you know, you really should be an RN. And then when I was an RN, later they said, well, you should orient new nurses. And then after that, they said, well, you would be a really good manager. And it was always someone telling me, you could do that. And so because someone said that I could, I did move forward. And then later on became the teaching. I think the rewards that I felt in moving from the clinical to teaching was that I really surprised myself that I really liked it so much. And to do it in a more formal setting rather than the informal teaching that I did all along in nursing. The other really reward or an unexpected piece was looking at the face of the student and seeing the aha, making the connection from what you're trying to teach and putting it into reality, or even having them think, oh, I remember now when I did this with this patient that's what that meant. So making that connection for the student and seeing it on their face is really exciting.
So some of the rewards are seeing your students finish at the end. You see them come in with very little medical knowledge or very little experience, and at the end you see them become competent professionals. And it's also rewarding because we live and work in this community. We sometimes are patients ourselves, or our family members are patients, and it's rewarding to see your former graduates taking care of you or your family members and being competent professional nurses. Most of what we're doing is training up a new group of people to replace us. What they need is our skills, and those sort of skills we've generated over our years of practice. And some of those, as I like to tell students, are skills as soon as you walk into a patient's room, knowing what you're looking at before you even touch or say anything to the patient. Those are the kind of skills that that nurses who have been practicing for a long time have and will transfer to students. Experiential kind of skills. What we teach students is the art of nursing, and that's not something that you can learn from a book, which is why there's so many clinical hours required for this program.
What a nurse with many years of experience could bring to the classroom is something that you can't write in a book. You can't read it anywhere, and that's the practicality, is taking the theory and actually implementing it in the clinical setting and making it relevant for the student and being current. So many of my examples that I give to students are things that I took directly from my workplace setting that was recent and applied it into the classroom, and that's when I got the aha moments and they understood. So those current work experiences are probably some of the most valuable things that the students of 30 and 40 years in that setting can bring to the classroom. When the student makes that connection from the theory to the reality, that they'll take that and use it for the rest of their lives, as I did with my own experience.
We work our students really, really hard, and so that means the faculty work really hard. There's a lot of reading. The faculty really need to do it too, because students will come in with questions from a little tiny sentence in the reading, and you've got to know what they're talking about. So there's a lot of reading for the faculty to do, and there's a lot of reading for the students, and a lot of grading of papers. So the workload is pretty intense. And then if you're teaching a subject which it's not part of your background as a nurse, then you've got to do extra reading to make sure that your knowledge is current.
No one person can know everything. So I know that when I don't know something, I know I can ask someone, or I will say to the student, I don't know that answer. I'll find out and I'll get back to you. And I feel comfortable about that. And my management experience, I think, was probably where I gained that knowledge, because somehow they expect managers to know everything.
So things that I have done as a faculty, a lot of extra reading, current articles. I've taken a couple of continuing education courses in the areas that I wasn't familiar. Some of the faculty have actually gone to the hospital and shadowed a nurse in that particular area. We also bring in local nurses who are experts to lecture in those areas, and we've done that before, because they'll be asking you questions, they'll be bringing you articles that they've found. So there will be some expectation from students that you're aggressively seeking knowledge if you don't have it. The art part of nursing is caring, having an awareness of cultural competence, having an awareness of physiology that isn't necessarily something that you've learned in a book. It's just a knowing about patients. Those are the kind of art things that are difficult to translate from a textbook.
How I overcame the fear of teaching is I have, I guess, an ability to go outside my comfort zone. And I think it's something that I've learned, that if I want to grow as a person, that's something that I need to do. So stretching myself and realizing, actually, it's not so bad being on the other side. Anyway, all the fears were usually not founded. And another part of the challenges were my speaking skills, that I wasn't confident in my speaking skills, so I took a course on that and really was able to pass beyond that insecurity of speaking to a group of people. And another area that was a challenge was identifying what my skill sets are and what kind of skill sets that I have gained and how they're transferable to other types of work. So how can a clinical nurse, how can those skills be transferable into teaching or managing? And so I actually took a course on how to develop a resume, and through that course I was able to realize, oh wow, I have a vast skill set, and that helped me a lot. We aren't taught to expand ourselves in many ways. We just like go into a field and feel like we're going to stay there the rest of our lives. But after I realized, oh wow, I did all of this and this and this in this job, and I can now take all of those things and move them to another job. So I think I would really recommend nurses to take a really broad look back at what kinds of skills they've developed over the years and realize that it's much more than you thought.
Seasoned nurses may not see themselves as educators, and yet if you look back at what they do for a living, they educate patients, they educate staff members, particularly if they've been nurses who are managers of a unit or team leaders. There's education that happens on a regular basis. So people may think that they're not a teacher, and yet when they look back, they realize that teaching is an integral part of nursing. And many of us do it very well and just don't give ourselves credit for it.
Teaching is a wonderful way to transition yourself into a new nursing profession. As nurses are nearing retirement, I've experienced myself and some of my other friends that once they get to that point, there's still that need to fulfill themselves with some kind of nursing work or sharing their knowledge. And one really great way to do that would be to become an instructor or a guest lecturer or an adjunct faculty in the nursing profession. So there's a way, there's many options out there besides just stopping nursing altogether. People would tell me, you know, you would be really good at teaching people. And so when I would step my toe into that water, I realized, yeah, you know, I am pretty good at this, and I do really like it. So I think the most important message is to listen to people who are advising you. And they may be some unexpected person, It may be an instructor, it may be an uncle or an aunt, but sometimes people have these pearls, or they see a strength in you that you actually don't even realize yourself. So stop sometimes and take note of those little pieces of guidance, and I think people know you sometimes better than you do.
A couple of things that were unexpected. I knew that the workload was going to be heavy. Certainly anyone who teaches any subject, whether it be elementary teacher up to high school, college, can tell you that there's a lot of work outside the classroom. The other unexpected thing is just the rewards. Especially seeing your first class of students graduate is very rewarding. We just recently had a pinning ceremony for a group of students, and it's really rewarding to see them graduate and become expert, new grad nurses practicing in the community. Whatcom has a mentoring program. In addition to our nursing program, we have nurses from the community that come alongside a nurse and are paired with a nursing student and support the nursing students. And I've heard our students talk about how they want to come back and be mentors when they've completed their program and when they have some years of experience as nurses. So our mentors primarily support the students socially, emotionally. They're there to ask questions of, if the students have questions or just need someone to go for a walk with. But they're nurses, and they know what it's like to be in the nursing clinical setting and to be a student nurse. Our new faculty get a lot of mentoring from experienced faculty. In each year we have a lead faculty who is responsible for mentoring the new faculty, adjunct faculty that are coming on board. So that would include clinical orientation, orientation to the syllabus, the textbooks, our grading practices. We do use an integrated concept map format for our care plan. So those are kind of things that you would get mentoring for as a new faculty from experienced faculty. I'm really into the simulation. I think that that is partly what makes our program unique. Simulation allows a student to experience these kind of situations on a simulated patient rather than on a real patient. Simulation has been used in other fields for many years. Flight simulators, pilots have been using simulators to simulate bad landings, for instance, and the medical community is just in the last 10 years gotten on board with using advanced technology to simulate medical emergencies. Our sim lab, primarily students practice the more difficult nursing skills and more difficult clinical situations. Although early on in their first year, they practice things such as cultural competence and caring. So some of the things that we're actually looking for in the simulation have more to do with really the art of nursing and those kind of conversational things that happen between a patient and a nurse. So what simulation is it involves using a high-tech mannequins that are essentially robots, to allow the students to practice critical clinical skills in the lab before they go out and do anything on a real human client. They practice some skills on each other. But the simulation actually requires a student to integrate all their skills. So in one simulation, if they're running a code, for instance, there may be a student starting an IV, there may be another student who's doing chest compressions, maybe another student who's preparing medications to give. So the simulation actually integrates a lot of clinical skills. And we may have a charge nurse who's dealing with a family member, and that's what she's learning in the simulation, is how to deal with upset family members. So the simulation allows students to learn multiple skills. We have multiple students participating in the simulation. In addition, our sim lab allows students to be taped during the simulation, and then they can watch it back and critique each other, look for feedback on what they did right and what they did wrong. Breaking sterile field, for instance, they'll catch that on the video where they may not have caught it during the simulation. Multiple faculty have gone to various classes to learn how to work the mannequins. But as a new faculty, you would be working with somebody who is experienced. So some of the learning would just occur in the simulation itself. And what our new faculty primarily do in simulation is just observe the students and write down what they're seeing and students' strengths and weaknesses and students that have difficulty in certain areas. Our new faculty wouldn't be expected to run the simulation the first year that they're doing it, just participate. We have a lab instructor who primarily sets up the simulations and is responsible for running them. If you find that you're in the clinical setting and you enjoy teaching your patients, and you get a nursing student occasionally and you enjoy working with a student, and you know that teaching is one of the things that you do well, you should consider being a nursing faculty. Because nursing faculty, more than anything else, they need to enjoy teaching. The requirements to teach at a collegiate level are basically a master's degree in nursing and at least 2 years of clinical experience. If you're interested in teaching and you think that you may be good at teaching, but you only have a bachelor's degree, you really should consider looking into some master's degree programs. There's a lot of online options available in distance learning. You really should consider looking into some programs. You may want to contact your state board of nursing. They usually maintain a list of approved master's degree programs in the state. And you also may want to contact your local college of nursing if you know that they're looking for faculty, to see what kind of support you can get at the local level. A good teacher is somebody who can inspire students to learn themselves. So just standing in front of a classroom and lecturing is really not enough. You need to be able to inspire students to actively seek knowledge. So the key to it is loving learning yourself and being excited about new research and new knowledge and gaining knowledge. I think loving learning yourself translates into having students that love learning. The other important thing about being a teacher is to be patient. You know, new nursing students they're fearful and they're nervous. They need somebody who can be patient with them in the clinical setting and in lecture. I would say that if you're interested in teaching, that you spend a day shadowing a faculty, that find somebody who's actively teaching and shadow them. Volunteer to come teach a lecture for a group of students on an area that you are an expert in, just to get your feet wet. Spend a day with the clinical instructor so that you can see what it is that they do. And we have a huge need for new nurses. I don't know the exact numbers that are projected, but there's a projection of a need for lots of new nurses in the next decade. Partially because a lot of our nurses are nearing retirement age. And we just don't have the capacity to educate them, and we don't have enough new nurses coming up. And we're expecting more people to be needing health care because of changes in health insurance. So there's going to be a huge need, and along with that huge need for nurses comes a need for faculty. It's always difficult to get people to sign up to teach or to be interested in teaching, partially because of some of the fears of being responsible for knowledge and translating that knowledge to the students. The future of our healthcare system really relies on nurses being willing to teach.
And that as a nurse, I would say to any nurse out there, don't second guess yourself. Give it a try. Talk to people about expanding yourself into a broader area, and maybe teaching might be one of those.